This time I'd like to open the floor for questions. Yes?
In your Oregon experience, have you seen an improvement in opportunity to provide wellness and prevention?
Yes, we have seen that. Actually, about 10% of my patients come to me through direct access. We've also been able to do some screenings for wellness and prevention. Several of my colleagues are doing a little bit more of that, so it definitely has opened up the possibilities for that as well.
Yes?
Yeah, is there a potential danger that if a patient sees a physical therapist through direct access, and maybe there is a condition that a physician needs to be involved, but a physician would not be involved with it?
Absolutely no danger. Physical therapists are trained to recognize conditions that are outside of their scope of practice, and current law actually already mandates that we refer to a physician anyone who requires the services beyond the scope of a PT. So we are well trained to recognize those conditions and those risk factors and refer to a physician as appropriate.
Patty, what's the timeline with introducing the legislation, and when do you think activity will occur?
The legislation has already been introduced. It has not been assigned to committee yet, but we are waiting for that to happen soon. And we are hoping that we can get it out of committee by the end of March, so that then it can move on to vote for the full legislature. Yes?
In the Oregon experience, have you found, subsequent to your passage, that the physician community in some way, shape, or form have also embraced it at times where they see the therapist as a referral source for them? And has that played out in Oregon?
Yeah, we have seen that as well. Several of our physicians really don't want to manage a simple low back pain patient or an ankle sprain. They know that we're certainly qualified to do that and appreciate us screening their patients for them appropriately. And we've actually seen that model in the system I work in, where we're expanding these direct access efforts to beyond low back pain to other musculoskeletal conditions as a way of screening it.
Have you seen any reduction in costs outside the scope of physical therapy, such as the unnecessary use of diagnostic imaging, which even in medicine oftentimes evidence-based practice doesn't make its way over the clinic?
The two biggest things we've seen with that Intel project I've mentioned are an increase in patient satisfaction, loss of time at work, but also a significant decrease in those diagnostic imaging costs. That's the only data that I'm aware of, but it's been a 30% decrease in their cost.
Could you expand a bit on the patient satisfaction that you've seen coming directly from physical therapy?
Maybe I'll just stay up here for a little bit. So each of the patients who are seen under this model with Intel are actually given a point of care survey where they're asked to rate their satisfaction with that. We've seen greater than 95% satisfaction with the visits that they've had.
Has direct access made any inroad at all to practice privileges for therapists in acute care settings?
I'm not aware of any changes there.
Has there been an impact on acute care practice as a result of direct access?
Not that I'm aware of.
Could you tell us more about this Evans Sport, or what you expect from membership?
Sure. Very good question. Actually, we are going to be contacting physical therapists that live in the districts of those individuals on the licensed activities committees right away, so that we can talk to those committee members. And then right after that, we're going to ask for an all-out push from all physical therapists in Illinois to start visiting their legislators, talking about the bill, and educating them about the bill. You can see at the tables, and hopefully we have extras around, that we have press packets with information to provide to your legislators and to educate you on the issue as well. And also, if you look at your buttons, on the very bottom, there's a website that says illinoisadapt.org. If you visit that website, you can get more information about the issue, and there is a direct link that both you and your patients can go on that website and contact their own legislators directly to make them aware of this issue.
Is there anything your friendly neighbors to the north can do, or?
Excellent point. Send money. Money always helps.
This is a question for Chris. Have you noticed a reduction in the number of average patient visits with this direct line of care program?
You know, the Intel project, we've seen the number of visits decrease to about 3.5 visits on average for those folks because they do get timely care. They're also uncomplicated. Part of that project is they triage through to make sure that these are uncomplicated patients first off. If they do have somewhat more complicated situations, they're still eligible to come see us under direct access, but they don't get triaged into that same program, so some of those data are a little skewed.
So what concerted effort can we bring the consumer, the healthcare consumer, in to help us pursue our initiatives?
I'm sorry, repeat it?
What other, how can we hold the support of our patients and the healthcare consumer to help guide our initiatives here?
Basically, spread the word, encourage them to visit the website. So publicize the website to your patients, to your friends, to your family members. Provide them with any information that you have. Ask them to get involved and contact their own legislators as well. And again, if you visit the illinoisadapt.org website, all of that information will be there along with quick and easy ways that they can get involved and participate in the process. All right. Well, thank you all once again for being here today to support this important legislation. This legislation will allow the people of Illinois to see a physical therapist without first obtaining a physician's referral. The delivery of healthcare services is changing. Please join us in asking the Illinois legislature to adapt to the future and allow direct access to physical therapy.